So IVF may not be affordable for everyone. There were hundreds of cases where there is actually male factor and female was literally tortured with IVF treatment. People think that miscarriage in first 3 months is related to a female, but actually in 50% of these couples, early pregnancy loss is because of the abnormal sperm or abnormal DNA fragmentation. 80% of these males, they have some minor issue which can be treated easily and they can get natural pregnancy. Varicocele is one of the common, after infection, this is second most common cause of infertility. This is seen in around 30 to 35% of infertile males. Even alcohol can impact sperm motility, morphology and hormonal. One of the major factors for sperm count improvement is change in lifestyle. See, overweight, it affects fertility in many ways. 30 to 40% of patients who are coming to our clinics, their main problem is infection.
So I also heard that worldwide sperm quality has been declining over the years and that these minimum thresholds have also been lowered. Is this true?
It's true, definitely.
What are the actual success rates for natural pregnancy, for an IUI, for an IVF?
Normally, for natural pregnancy, success rate is around 5 to 8%. Every month, it's around 5 to 8%.
Okay.
For IUI, it is between 10 to 20%. IVF success rate is around 45 to 50%.
So when we talk about fertility, the spotlight usually always falls on the woman. Yet, conception is half male. But male fertility remains one of the least spoken about topics in overall healthcare. Today, we're sitting with somebody who's completely changing that narrative, Dr. Rahul Reddy, India's leading andrologist with over 2 decades of experience. So Dr. Rahul Reddy has helped thousands of couples conceive, deal with male health, and a lot more. Today we'll be diving deep into male fertility and more. So first of all, thank you so much, Dr. Rahul, for sitting down with us and taking out time from your busy schedule. We know you're packed 2 months in advance and it's very difficult to even get an appointment with you. So thank you for taking out the time today. So there's a lot of questions in male fertility health that we keep getting that we really wanted to unpack with you today. So can we dive right into it?
Yeah, I'm ready.
Okay. So first of all, why do you think male fertility is such a neglected topic, even though it's so important?
See, basically, the understanding about male infertility was very less. And even this branch, andrology, was not chosen by urologists. Most of the urologists were overburdened by stonework, kidney problems, kidney transplantations. So they didn't had enough time to treat these patients or concentrate on male infertility. So now even the understanding of male infertility was very, very little. So we used to think that once sperm is abnormal, it's always abnormal. And nobody knows why it was abnormal. What were the reasons for all those issues? So that is the reason there were no doctors to treat, and gynecologists, most of the gynecologists were clueless. So they used to think that once sperm is abnormal, they used to think it's abnormal and they used to go ahead with IUI and IVF treatment. So this went on for almost 1 decade. Okay. And then after that, they stopped thinking about males. Even now, if you ask most of the fertility centers, they say that 1 sperm is enough to do IVF. But nobody thinks about improving the male factor and trying for natural pregnancy.
Correct.
Or somebody is in IVF range, how can we take them to IUI? We call it as downgrading the treatment.
Okay.
So IVF may not be affordable for everyone.
Correct.
And may not be interested to see. It's not a simple treatment. It's complex treatment. So now what we have to do is we have to downgrade the treatment. If a couple is actually going for IVF, how can we bring them to IUI level? If they are actually planning for IUI, then how can we make them conceive naturally? So that is important.
Okay.
That was missing all these years because of lack of awareness on male infertility and lack of doctors who treat male fertility.
Right. So even today, I think there's a huge stigma associated with male fertility and in the fraternity, and even with couples who are having issues in their infertility, right? Nobody wants to even look at the male factor.
Any mother, she will always blame her daughter-in-law, not the son. Now, if you ask any mother who comes to clinic along with her son, she'll always say that, doctor, in our family there is no male issue. So you evaluate my daughter-in-law, and there should be some problem with her. And second thing was male ego. So they were never ready to give a semen analysis.
Correct.
There were hundreds of cases where there is actually male factor and female was literally tortured with IVF treatment. I had one couple from Hyderabad. He got married 4 times.
Oh my God.
And never tested. He was getting married, no children. So
Again, next wife.
Finally, they came to know that he had 0 sperm count. Even then, mother comes and says, "Doctor, I think report is wrong. Why can't you test it again?"
No,
She
they're
was
not willing to accept.
She was not ready to accept. But now things have changed. And people are coming forward for tests. But still in peripheries, gynecologist doctors, see, now 80% of male fertility is seen by gynecologist.
Okay.
And things have to change from that fact. See, not every patient can afford an andrologist treatment. He can't come to metro cities and consult an andrologist.
Correct.
Even in district headquarters, there are urologists, but they are already busy with other works. And they may not give enough time for male factor evaluation. So now this burden is on gynecologists. So now what we are doing is we are trying to educate gynecologists so that they will start their evaluation with male factor. See, doing a semen analysis, simple semen analysis, easier than evaluating a female.
Okay.
Doing scan, AMH test, hormone test. It's little difficult to understand. But male factor is very simple. Basically, we don't need any andrologist to understand a male. Even an MBBS doctor can understand. Only thing is he needs little knowledge about hormones, how testis works, how sperm is produced, and what are the levels of sperm production.
Okay.
If any doctor knows all these things, they can easily treat.
Okay.
So that is what we are changing. We are not trying to change people. We are trying to change the trainers. So once we educate gynecologists, even now in peripheries, people are actually going behind females. They are evaluating for months. Later, they are asking for semen analysis.
Correct.
There is one more practical issue here. And regarding laboratories, there are not many labs who can do a proper semen analysis in district headquarters. In fact, even in Hyderabad, if you ask us, entire Hyderabad, there are only 20-25 labs who can do proper semen analysis.
Okay.
Out of all those hundreds of diagnostic centers. Even those famous chains of diagnostic centers, nowadays, even though they have 30-40 branches, but they are not doing semen analysis in all those branches.
Why?
Because it needs technical expertise. See, regular lab technician cannot do that semen analysis.
Okay.
So we need an andrology technician who is properly trained in semen analysis. So even now we have scarcity of these andrology technicians. Slowly, people are actually lab technicians. Slowly, they are getting trained in andrology courses. Now they are doing semen analysis, but the number of people who are doing are less. And once they do this course, and their salary pay packages are going up rapidly. So in India, lab technician charge is around 15,000. His salary is around 15,000. The moment they complete this course, they are expecting 50,000 to 60,000. Most of the labs are not able to afford them.
Okay.
And that is the reason even gynecologists, they know that anyway, even if they do the semen analysis in a small lab, they are not going to get a proper report.
Correct.
They think why to get a semen analysis which they can't trust. So that is the reason they are starting with female factor. And once things are out of hand, then they are sending this patient for semen analysis to a nearby city.
Correct. Basically, they'll start with female evaluation. They'll say planned pregnancy. Then something goes wrong. After months, then they'll come back and say, now let's test the male factor. So by then, that entire duress has already happened.
Now, luckily, there are some portable machines.
Okay.
Portable machines to do semen analysis. So now any technician without any basic knowledge of semen analysis, they can do semen analysis with these machines.
Okay.
They are not 100% accurate, but at least instead of semen analysis getting done by a untrained person,
Okay.
these are portable machines, AI based machines. Now we can trust them at least to some extent.
Okay. So, Dr. Rahul, I want to take a step back. So, say a couple decides they want to start planning pregnancy, or they're already in the process of planning pregnancy and they're not getting pregnant.
Yes.
Who is the first person they should go and see in terms of female fertility, in terms of male fertility?
See, basically they have to go and see a nearby gynecologist.
Okay.
That too, who has some time to see them.
Okay.
See, now, if you see gynecologists, some gynecologists in peripheries, they are busy with their obstetric work. And some gynecologists, they are interested in fertility work. Not
Okay.
many gynecologists. The same thing goes with urologists also. 90% of urologists, they are busy with their regular work. So they don't show interest to treat male fertility or andrology issues. They think that it's a time-taking issue. So now same way with the gynecologist. So if there is a good andrologist nearby, that's always better to consult an andrologist.
Okay.
Otherwise, they can consult a good gynecologist. And see, instead of consulting a gynecologist and then getting test done, for males, it's very simple. They can go to a good lab, do a semen analysis.
And take those reports to the gynecologist if andrologist is not available nearby.
So gynecologists won't have to ask for the report.
You'll
By
already
the time they go there, there is a report.
have.
And it's very simple. It's not expensive. She knows whether it's normal or not.
Correct. So now if somebody does the test and then they take it to the gynecologist, will the gynecologist herself be able to review it without needing any further testing by an andrologist or anything of that sort?
They can. See, that is
Okay.
what we are doing.
Okay.
We are actually giving training to most of the gynecologists, and even most of the conferences. We are having a session on male fertility. And most of the gynecologists from peripheries, now they are showing interest in this male fertility course.
Okay.
So as I said, actually we don't need any andrologist or urologist to evaluate a male factor
Okay.
in fertility. Any gynecologist or even MBBS doctor,
Can
if he is
review.
properly trained, he can train.
Okay.
And what we need for male infertility is very little. One, proper semen analysis, and doctor has to understand that whether this is properly done or not.
It's from a good lab or not?
Whether it is from good lab or not, whether the lab followed latest WHO guidelines or not. WHO releases guidelines every once in 2-3 years. They release a guideline on latest semen parameters, percentile value. So they just have to check. And if it is abnormal, they can start basic treatment. But basic treatment should not be more than 2 to 3 months.
Okay.
If patient is not responding to that treatment, then they can refer that patient to an andrologist.
Okay. So if some couple comes to you for planning pregnancy, apart from semen analysis, what else do you suggest?
See, ours is a tertiary care center. By the time patient comes to us, most probably they must have spent
Already months.
months of treatment. Then only they come to us. So generally what we do is one semen, in semen analysis, the semen analysis part is a basic test. In semen analysis, what we are seeing is how many sperms are there, how many of them are moving, how many of them are physically normal.
Sperm
Morphology, we
count,
call it.
sperm motility, sperm morphology.
That is what we are seeing. But actually a sperm is like a vehicle.
Okay.
It has to carry male's part of DNA to the egg. Now what if the DNA itself is abnormal? So that is where advanced sperm tests come into picture.
Okay.
Second thing, even though this particular male is having hundreds of millions of sperms, whether there is fertilizing capacity, whether this sperm can really penetrate the egg or not, that is important.
Okay.
Having number of sperms is only a basic test. So that is what basic test semen analysis is enough. But in spite of normal parameters, if the couple is not getting conceived, we have to do advanced sperm tests like DNA fragmentation index. In short, we call it as DFI. Second, ROS test, and the third one is culture.
Okay.
We say culture is very important in nowadays because infections are common. 30 to 40% of patients who are coming to our clinics, their main problem is infection. Another 30 to 40% of males who are having infertility problems, issue is varicocele.
Okay.
So varicocele, again, we need a proper scrotal Doppler to check whether this patient is having varicocele or not, and semen test. And sometimes this sperm production in males is actually governed by hormones. So we do a hormone test. These three are enough. Apart from this, vitamins. Two vital important vitamins which can control sperm production are vitamin D and B12. So apart from these tests, we don't need anything.
Okay. So I want to get into all of this one by one. So to begin with, when it comes to semen analysis, what are the parameters, that minimum threshold that they need to meet?
Yes.
So when it comes to first sperm count.
Okay. No, see, semen analysis, we divide them into two topics.
Okay.
Macroscopic and microscopic.
Okay.
Macroscopic in the sense, the moment we see a semen sample, what we can do. So now first one is volume. So basic semen volume should be at least 1.5 ml per ejaculate.
Okay.
So that is the reason we say patient needs at least, any person who want to do semen analysis, he needs at least 2 to 3 days gap.
Okay.
Abstinence period.
Abstinence period. Okay.
So with 3 days abstinence period, minimum volume should be 1.5.
Okay.
And second thing what we see is color. So if it is normal semen color, half white color, then it's okay. Otherwise, if it is red, then it's a sign of blood in the semen. If it is yellow or green, then it's a sign of infection.
Okay.
Sometimes it can be brown, it can be a whole mixed blood in the semen. So now color and volume, these are important because if volume is less, in spite of normal count, normal morphology, normal motility, normal pregnancy may not happen.
Okay.
The vaginal acidity has to be neutralized by seminal pH.
Okay.
So now if semen volume is less, then this can't neutralize the vaginal acidity. So that can affect fertility. So volume is important. If volume is low, there are only 3 reasons. One, the person may have sample collection problem because many men, they don't know how to, and they don't know how to masturbate, how to give a semen sample. So those who can't masturbate, it's very difficult for them to give a semen sample. So we have to ask them whether really they know how to masturbate or not. We can't force them to give sample. Second thing is low hormone. If volume is low, if there is low testosterone or thyroid issues, it can affect the semen value. So then we have to check for the testosterone levels. Another factor which can affect volume is infections or blockage.
Okay.
If there is infection in the prostate, seminal vesicle, where 80% of the seminal fluid is produced by prostate and seminal vesicle. So infection can bring down this value. So now semen value, these 3 parameters will affect.
Correct.
Then next one is color. I said color is based on infection and other things. Then comes to microscopic findings.
Which is about the semen now.
Semen. So now microscopic means these are only checked through microscope only. We can't see directly. So in microscopic findings, we look for count, concentration. Second one is motility, and third one is morphology.
Okay.
According to latest guidelines, WHO guidelines, sperm count should be minimum of 16 millions per ml.
Okay.
So we always say that it's concentration, it's per ml. So this is not the normal value. What we have to understand is 16 millions is not normal. It is the lowest possible value where natural pregnancy can happen.
So it's the minimum threshold.
Minimum threshold. See now this is 5th percentile value.
Okay.
WHO has divided this into 5th percentile value, 50th percentile and 95th percentile.
Okay.
So now this is the 5th percentile value. 50th percentile is around 40 to 50 millions.
Okay.
So on average, we have to consider that 40 to 50 million is
the
normal,
average.
is average, and minimum threshold is 16 millions.
Okay.
Then coming to motility.
Hmm.
Motility, there were so many confusions.
Hmm.
One study, they say we have to divide it into rapid progressive, slow progressive. That means fast moving sperms and slow moving sperms, and forward moving sperms and side moving sperms.
Okay.
So now all those things were taken out. There is only progressive motility. If progressive motility is more than 30%, 30% value is again 5th percentile value. Minimum. And 45 to 50% motility is average.
Okay.
So now motility, it should be a forward progressive motility. And now according to latest guidelines, they brought back rapid progressive motility. But nowadays we are not giving importance to that.
Okay.
Because progressive motility, we can easily improve it to rapid progressive motility.
Okay.
Once there is sperm is motile, we can make it fast.
Okay.
And then morphology.
Okay.
Morphology minimum is 4%, and average value is around 12 to 15%.
Okay. Again,
That is
4%
50th
is the minimum.
That is 5th percentile.
Okay.
So all these are important. See, now if you ask me what is important, all these are important. Count should be more than 16 millions. Motility should be more than 30%, and morphology should be more than 4%.
At least.
Suppose if count is around 30-40 millions, but motility is less than 20%, still
You'll have an issue. Okay. So I also heard that worldwide sperm quality has been declining over the years, and that these minimum thresholds have also been lowered.
Yes.
Is this true, or is it just
No, it's true. Definitely.
Okay.
See, now first and second guidelines, they said that 60 millions was the minimum count, and then 40 millions. Now why it has come to 16 millions is because of rapidly declining counts all over the world. And there are so many reasons for that. So to discuss reasons, I think it's a different topic. But the major reason for this is microplastics. So last 1 decade, we have been depending on plastic for everything. And plastic is like we call plastic as male endocrine disruptor.
Okay.
So knowingly or unknowingly, we are depending on plastic for everything. For water, food, food transportation, for cooking, heating. So we have been using plastic for last 10 years. So now what plastic does is, there is a chemical called bisphenol in plastic. This bisphenol, whenever this plastic is exposed to heat, so then this bisphenol is released into that food part.
Okay.
It enters our body, it affects hormonal center. So that is why it's called male endocrine disruptor. And basically what it does is, it converts testosterone into estradiol, and testosterone production goes down, which is a male hormone is going down, and female hormone, which is estradiol, is on the rise.
Okay.
So now when there is this imbalance between these two hormones, and it affects all the systems in the body, and mainly first thing it affects is fertility. So it affects spermatogenesis. So spermatogenesis, when it is affected, not only, see, this is not for one generation. Once it enters into our system, it can go on for 3 generations.
Okay.
So that is the reason our fertility, our counts have gone down. And even the next generation kids, what we are seeing now, who are in around 5 to 15 years age group, why they have so many other issues is because of this hormonal problem.
Even before puberty, they're starting to have some
because
sort
there
of
is hormonal imbalance by birth.
Hmm.
And normally what we think about plastic is, normally when you want water, you go to a shop, you get water bottle, you drink it. But what is happening at manufacturing level, they're actually filtering the water, they're actually putting in the bottle, and transportation. Most of these issues, exposure to heat, is happening in transportation, whether it is water bottle or cooling bottle. Now you might have seen how it is getting transported.
Correct.
Most of the times it is transported in trucks.
Correct.
So now trucks, they travel hundreds of kilometers in sunlight before they reach
the destination. The shop.
So by the time the damage has
already
happened.
done.
So now all our water bottles, cool drink bottles, at some point they're exposed to sunlight or heat. So they're all polluted. Second thing, we used to get curries and food from hotels. Even now, most of the, if you check Swiggy and Zomato, whenever you order something, they're still packing them in plastic
Yeah.
plastic containers.
Yeah.
So again, those are already exposed to it. By the time they reach you, the food is exposed to bisphenol. So these are all silent killers. See, so we may not understand the impact of this, but that is what we are seeing in reality. Infertility is same thing. What should have done 10 years ago, still now it is continuing.
So a lot of people don't believe the impact that this is having on
Yes.
their body. So is this studied? Are there enough tests done?
Hundreds
Research labs?
Hundreds of tests. See, now the concept of BPA has come into picture only because of this. Now, if you see the milk bottles, baby feeding bottles, what were there before? So before this BPA era, we used to use normal plastic bottles.
Correct.
We used to reheat them, we used to boil them,
Correct.
and we used to feed babies with the same bottles.
Yeah.
So babies were fed with bisphenol. So now then government understood that, and
Exactly.
then this BPA free, bisphenol free containers have come into picture now.
So I have a couple of questions now. So before we were talking about labs,
Yes.
where you should go to proper labs and get tested.
Yes.
So recently we had a couple who the man had gotten a semen analysis.
Yes.
He went to some center. His semen analysis was 5 million.
Yes.
2 weeks later, he came to Androcare, basically all up because he was in
Yes.
Hyderabad. Because for some reason he had gone to a gynecologist and they said, no, get the test done again.
Yes.
2 weeks later, his semen analysis report showed that it was 12 million, not 5 million,
Yes.
the count. So how is such a big discrepancy happening?
Two things here. One can be a lab error because the technician who is doing there may not be trained. Now, see, Androcare, we have a training, it's a training center. We train technicians in doing semen analysis. So now we follow a 3-step protocol. One junior technician starts the test. All semen analysis were recorded.
Okay.
So even after 1 month, we can get back to that report. We can
Okay.
see the video so that anybody can re-report it. So then this has to be checked by senior technician, and finally our doctor checks it and then signs the report. But this can't happen in every center. They might have only one andrology technician who is busy, and they may not have enough time to do semen analysis. Now, semen analysis part, the timing of semen analysis is very important. You can't wait for hours to do semen analysis. The moment sample is given, within 30-40 minutes, they have to start the test.
Okay.
And they have to do motility assessment and concentration assessment immediately after 30-40 minutes.
Okay.
But the morphology part is very important. That takes at least 2 to 3 hours.
Okay.
If any lab is giving a semen analysis report in less than 2 to 3 hours time, then you have to
Think about
it. It needs minimum. You have to check for at least 100-200 sperms under high power microscope. To check each sperm under high power microscope, it takes at least 10 seconds.
Okay.
For any person.
Okay.
So then he has to adjust, go to the second sperm. So now you have to understand why it takes time. But if you ask most of the semen diagnostic centers and infertility centers, they can give sample in half an hour also, they can give a report. And one more issue, there is commercial angle. I don't say all fertility centers are doing, some fertility centers are doing that. To counsel them for IVF or to make the patient prepare for IVF, they always give less counts.
Underreporting.
Underreporting. But it may not happen in many centers, but majority centers, what I have seen, they always underreport.
What is the reason for underreporting?
Underreporting, see now, the main purpose for IVF centers is to do IVF. There are some centers which are actually owned by doctors.
Okay.
There is some ethical
Practice.
angle there. And whenever a non-doctor invests in any fertility center, they never look for natural fertility angle. They only want
More IVFs to be done.
how many IVFs were done, what was the business generated in that particular month. So now there might be some indirect pressure on them to convert these couples for IVF. So actually what happens, people also don't know where to go. When they find a semen analysis report which is abnormal, first thing is they think of IVF center. They don't go to an andrologist. So the moment they go to an IVF center, first thing center does is they think that patient has come for IVF only.
Correct.
So they always try to counsel them for IVF based on their report. They say that, see, this report is very less. If you don't do IVF now, your sperm count may become 0. Then once it is 0, then you might have to go for donor sperm. So the moment they hear about donor sperm, they get tempted. They think, why to wait till it becomes 0? They go for IVF. But problem starts when IVF fails. So now even IVF centers, ethically what they have to do is, the moment they see a negative sample or a bad semen analysis sample, they have to evaluate the couple. Why the semen analysis is abnormal? It can be a simple infection which can get easily treated, or simple hormonal imbalance. So now we have to, once they evaluate, they will know why this semen parameter, particular semen parameter is abnormal, and how can we treat that. So that is the angle they have to actually look at it. But they are not actually looking into all those parameters. And even today, in 2025, where every fertility center has to do a DFI test before IVF, 70 to 80% of centers still they don't do DNA fragmentation test before IVF.
So they're using the sperm sample without checking the
DNA fragmentation.
So we don't even know if the sperm sample has the complete DNA.
Yes.
And then with that only the embryo is being made.
See, the reason for that is, now if you do a DNA fragmentation test, what if DNA fragmentation is abnormal? Then they can't go ahead with the cycle.
Correct.
So they have to wait for the patient's DFI to improve. So what if DFI improves and they get natural pregnancy? They lose a patient. So when I started my career around 2012-13, when I started, just before starting andro care, I visited hundreds of gynecologists.
Okay.
Because nobody knows who is an andrologist.
Correct.
So I visited them and I asked them, Madam, I'm an andrologist. Basically, I'm a urologist. Now I'm doing my andrology practice. Most of the gynecologists who are doing freelance practice, then they responded positively. They started sending me patients. They started doing semen analysis first. Instead of evaluating female, then they started.
Okay.
Then I visited a couple of fertility centers. Now most of those fertility centers are closed now. They are not existing.
Okay.
One doctor openly said, why should I refer my patient and lose 2 lakhs rupees? Every patient is worth 2 lakhs those days in 2012.
Now it's even more.
Even more. She said, why should I lose my 2 lakhs? You tell me one reason, why should I refer you? Then I said, Madam, it's based on practice. See, now not only this 2 lakhs, it can improve your success rate.
Correct.
It can improve your pregnancy rates. I said, I'm least bothered.
Because if one IVF fails, they'll get another IVF.
Other IVF. So, but same doctor called me after 6 months and referred her own relative.
Oh.
For her relative,
Oh my God.
she wants
the best treatment,
best
the correct
treatment.
protocol.
But for others, she never. That was the only patient he referred in last 10 years.
Oh my God.
So then you can understand how a fertility center thinks.
I think this is exactly the opposite of what you said. You spoke about downgrading.
Yes.
Here, upgrading is
Upgrade,
happening.
yes.
Where natural fertility, there IUI, where IUI fails, then IVF.
Only
It's the
concern
exact
is,
opposite of what you said.
yeah, the only thing that patient has to come only for IVF. And even if you refer a patient for IUI, it's not happening. The
Yeah.
moment patient goes there with all parameters which are in IUI range, they start counseling for IVF.
Now, the one more problem that I think I've noticed is that in every lane there's a fertility center.
Yes.
You don't know the difference between a IVF fertility center, an authentic doctor
Yes.
who's going to do the best for you. So as soon as you think of pregnancy planning, you go to a fertility center,
Yes.
and you don't know the intention of that fertility center.
Don't.
is.
See, there can be a success rate.
Yeah.
See, now success rate can be by any center. If doctor and embryologists are good, they can give a success rate.
Correct.
But is the IVF necessary?
Correct.
That is important.
Correct.
Maybe by giving simple treatment,
It will be rectified.
they may get a natural pregnancy.
Yeah.
Or at least, so now 2 to 2.5 lakhs is not a small amount.
Huge
But,
amount.
huge amount. And this 2 to 2.5 lakhs is not the only amount what they pay. So before IVF, they do a lot of tests that will go on for, and they do laparoscopy, hysteroscopy. So overall, the package is around 3 to 5 lakhs now. Some centers, premium centers, it's around 6 to 7 lakhs also.
It's a
But
huge-
one cycle. Now, after losing that money, if they have to think of another cycle, generally, fertility centers' perception is one IVF failure. Why should I try for natural pregnancy?
Go for another.
But again, IVF. So now they don't think that why first IVF is a failure.
Correct.
Some centers don't even think of doing first center did a mistake. No DNA fragmentation report, no evaluation. They did IVF. IVF was a failure. If patient goes to second center is not thinking about why there was
Why
a
it
failure.
failed.
So at least they have to evaluate. Now only there are around 30% centers who are thinking about patient. Now some centers, they call me and say, sir, there is one IVF failure. We have to find out the IVF cause for that failure.
At least that's very good ethical.
Yes.
Yeah.
So I counsel the couple that to wait for 2 to 3 months. You evaluate and send them back. Well, it's a good thing.
Yeah.
At least there are some doctors who are actually thinking in that way.
Yeah.
But remaining centers who are actually in pressure, they are not worried about DNA fragmentation report, whether there is any culture report. They want only whether sperm is there or not. Even if sperm is 0, there are centers who are not actually counseling for TISA procedure. Sometimes we can get, even if a patient is having 0 sperm count, we can get some sperms from the testis.
Okay.
So there are procedures like TISA, micro TISA, where we can get their own sperms and we can get pregnancy with their own.
Okay.
But the moment they see a azoospermic patient, most of the fertility centers are counseling them for donor sperm. Luckily, if it fails, it's okay. What if it is successful? They have to carry that burden for lifelong.
When they wanted their own
Yes.
child. So now I have another question, because we have seen couples who have been counseled for, say, IUI or IVF. It has failed. Then they've come back and gotten
Yes.
pregnant naturally.
Yes.
So now, from a perspective of, a lot of experience, what are the actual success rates for natural pregnancy, for an IUI, for an IVF?
See, now normally for natural pregnancy, success rate is around 5 to 8%.
Okay.
So that means if 100 couples are trying with normal semen parameters, then 5 to 8 couples can get pregnancy in that particular month. That is how we
in
have to
1
count.
month.
1 month.
Yeah. So
1 month. That
every
is per
month you
month.
have a-
Yes. Every month it's around 5 to 8%.
Okay.
For IUI, it is between 10 to 20%.
Okay.
So if you compare with natural pregnancy, if you consider 5% is chance for natural pregnancy, so 20% means there is 4 times better chance with
In an
IUI.
IUI.
And with IVF, even so-called world's best centers, IVF centers, they say their success rate is only 45 to 50%. And if any center says that their success rate is 80%, 70%, 90%, it's all only marketing.
Okay.
In reality, IVF success rate is around 45 to 50%.
Okay.
And majority patients also, they think in a different way.
Hmm.
When we ask, why did you go to this particular center? They say, Sir, we visited 3 centers. One center said their success rate is 50%. One center said 80%. So we visited the center who said 80%. No, it's a marketing tactic.
Yeah.
So what we have to understand is probably if we evaluate properly, prepare the couple properly, and before taking them for IVF, see if they are actually candidates for IVF. If you spend some time in finding out their DFI value, improving their semen parameters, improving their oocyte quality, then success rate may go up.
Okay.
But without doing all these things, expecting 80% is it's not possible.
So another follow-up question I have to this is, when you're looking at success rate of IUI or IVF,
Yes.
you're looking at that given treatment because it's done only in 1 month.
Yes.
But a more fair way to compare would be to natural pregnancy if you're looking at a say 6-month window.
Yes.
Because when you're trying naturally, you won't just look at 1 month.
Yes.
So if you compare say a 6-month period where somebody is trying naturally for say 6 months,
Yes.
comparing that to an IUI or IVF, does that increase the chances overall?
No, definitely. See, now every month it's 5%. So you have that 5% chance every month. So now that is the reason WHO says if before starting IVF treatment, you have to wait for at least for 1 year. So now 1 year, so 5% every month. So that means you are actually calculating 60% chance. So if a couple who are having normal parameters, if they try for 1 year and still not getting conceived, then we have to start evaluation.
Correct.
But that may not be true in all couples. Now, suppose if a couple is getting married in 30 plus years group, so now their waiting for 1 year may cause further damage. So now if anybody is getting married after 30, it's better to evaluate immediately. They don't have to wait because semen analysis is not an expensive test. Hardly it costs around 700 to 800 rupees.
Correct.
So if they go for evaluation, if it is normal, then they can try for 1 year. But if it is abnormal, then there is no point in waiting for 1 year. So they have to start evaluation and treatment immediately after the marriage.
Okay.
But if anybody is getting married before 30, they have enough time. Before till 30 they can try, and after 30 they can come for evaluation.
Okay. So another question that I had is, say you get your semen analysis done, some of your parameters are abnormal. At that point, instead of jumping into a fertility treatment, because your chances of success are low, how long should you wait? What should you do to improve your metrics in that given amount of time, along with visiting an andrologist and taking the medication? And when should you continue trying until before you even consider some sort of treatment?
See, now that is where evaluation comes into picture. Now, normally when a patient with low semen count or motility morphology comes to us, first thing what we do is we'll evaluate the patient. We'll find out the root cause. The moment we know the root cause, we'll know whether this patient is going to improve or not. So first thing is whether this person can we improve it to natural fertility range or not? We'll
can we
understand.
downgrade them?
Yes,
basically?
yes. Second thing, if we can't improve, at least can we improve quality of the sperm, or can we decrease their DNA fragmentation? That is what we have to look at. So here, important point what we have to understand is sperm production cycle. One sperm production cycle is around 60 to 74 days.
Okay.
That means 8 to 10 weeks.
Okay.
So now, medication part, we have to try for 2 spermatogenetic cycles.
Okay.
That means at least around 4 to 5 months.
Okay.
In 4 to 5 months, if there is no improvement, then we have to consider that they are not responding to medical treatment.
Got it.
Then they have to go for the next procedure.
Got it.
And always jumping the procedure may not help. Sometimes fertility centers, they say that IUI success rate is less. So we'll directly go for IVF.
Try faster so that your metrics don't fall.
But see, what they are not justifying is IUI will cost only 15,000-20,000 rupees. And the medications what they give for the female is hardly less than 10% of what they give for IVF. But what they are doing there now, financial burden and hormonal burden. How many injections this poor lady has to take for IVF? They are not considering that. And can they give 100% success in IVF? It's not possible. So now once IVF fails, then this poor couple again, they're coming back to square one.
Yeah.
And they don't know what to do. IVF failure, they lost money and they lost hope. Then they start worrying. So always fertility treatments should be step-based treatments. We have to basically basic evaluation, should try for natural pregnancy first. If it is not happening, then IUI, then IVF.
Okay. So, in your experience, what are some examples of patients you've seen with abnormal semen analysis but have conceived naturally? Like, what metrics usually can improve and can they get pregnant naturally? What are when do you suggest that this couple will probably get pregnant naturally?
No, that is what we see. See, now every day I go home with at least 3 to 4 sweet boxes.
Okay.
Now, all my staff, by evening, generally I don't take them home, I distribute to my staff.
Yeah.
So evening, daily they will tell us that today we got 3 boxes, 4 boxes. That means all are actually natural pregnancies.
That's the happiest usually.
moment.
Yeah.
So after a tiring day, the moment my staff says, sir, and most of the people, they may not meet me directly.
Correct.
Because of appointments.
Correct.
They give a small letter and sweet box and they go back.
Yeah.
So that is the happiest moment for us, and it's a stress buster. Today we know that, okay, how many happy couples are there?
Yeah.
See, 80% of males, if we treat properly with low sperm count, we can actually get them natural pregnancy.
Okay.
And 2 common issues what we see, one is infection. It's very easy to treat, low dose antibiotics. Most of the people respond easily. Sometimes they come back with pregnancy in 1 or 2 months.
Okay.
And if you see couple with recurrent pregnancy loss, miscarriages, people think that miscarriage in first 3 months is related to a female partner.
Correct.
But actually, in 50% of these couples, early pregnancy loss is because of the abnormal sperm or abnormal DNA fragmentation of the sperm. Most common cause is infection.
More than abnormal sperm or more than DFI
Yes.
is infection.
Infection.
Okay.
So infection is causing this damage.
Okay.
Infection is rising their DNA fragmentation level.
Okay. Because of the infection, more DNA is fragmented.
Because of the fragmented DNA, even if that sperm goes and fertilizes, it is leading to miscarriage.
Okay.
But it's very simple. The moment you treat, they come back with natural pregnancy.
Okay.
So we see hundreds of couples every month. Most of them must have undergone, one example what I can say is, one couple came to me with 7 to 8 years of infertility. There were 4 miscarriages.
Okay.
So after 2 miscarriages, they did almost 7 to 8 semen analysis in small diagnostic centers. They were from a small town, not even a district headquarters, small town. They did semen analysis. All semen samples were showing normal parameters, all normal parameters. Morphology was 80%, 90% in every semen analysis report. So gynecologist must have thought that his semen analysis is normal. But unfortunately, every semen sample, there were pus cells.
Okay.
So they
That were
neglected. Missed. So they didn't even do culture. So after 2 miscarriages, then they started our treatment. They did 3 IUIs. Out of 3 IUIs, 1 was successful, but again miscarriage. Then they started IVF. They did 2 IVFs. First IVF was a failure. Second IVF, again pregnancy was there, but again miscarriage. After all this trauma, then one gynecologist referred this patient to me saying that, sir, I am seeing pus cells. Better evaluate. Already they came to me with all this history.
Already 2 failed IUIs and 2 failed IVFs. After that, they came to you.
Yes. 4 miscarriages. With IUI, 1 miscarriage, naturally 2 miscarriages.
And with IVF, 1 miscarriage.
And she has gained 35 kilos with all this treatment.
With all the hormones.
With all the hormones. Now, when we checked, it was only a simple seminal infection which was causing all the drama. His DNA fragmentation was very high. It was 57.
Oh God.
Only because of infection. We just gave antibiotics for 2 months. DFI came down to 18.
To 18.
18. Then we asked them to try naturally. They conceived naturally without any miscarriage.
Oh wow.
So now you can understand the trauma, money, how much 7 to 8 years of their
Life.
So now sometimes it's very easy to treat these patients, but only thing is we have to
correct.
evaluate properly. And 80% of these males, they have some minor issue which can be treated easily, and they can get natural pregnancy. There are some couples who has genetic issues, and males who are born with small testes, and males who are born for parents who had consanguineous marriage. So
Basically in the same family.
So now for them, we may not be in a position to get a natural pregnancy, but at least we can help them to improve the sperm quality.
Okay.
But there we have to tell them what is possible. So we should not give them abnormal or hope for false hope. So we have to tell them, see, this is the reality, but we can improve your semen parameters. So we will try to at least push them to IUI range, so that instead of doing an IVF, they can go for an IUI.
Okay. So another question that based on a lot of the couples we see is a lot of the men are being identified as something called varicocele.
Yes.
Grade 1, grade 2, grade 3.
Yes.
So is this also as easily treatable as infections? What exactly is it? More about varicocele in general.
See, varicocele is one of the common, after infection, this is second most common cause of infertility.
Okay.
So this is seen in around 30 to 35% of infertile males.
Okay.
So now varicocele is a very simple problem where the testicular veins are not draining the impure blood properly. See, normally there are arteries and veins in the in every organ. The function of arteries is to bring pure blood. The function of veins is to take back that impure blood for the purification process. The veins which are in the testes, if they are not functioning properly or if they are damaged, we call it as varicocele.
Okay.
And it's a genetic problem.
Okay.
It has nothing to do with our lifestyle.
Okay.
There is a myth, people think that they get varicocele because of some trauma, because of some other issues. Basically, varicocele is a genetic issue. There are veins, bulged veins in the legs. We call them as varicose veins.
Correct, yeah.
And bulged veins in testis are called varicocele. Both are related. Both are related to same genetic problem. Sometimes it can come in legs, sometimes it can come in testis. So females, generally we see it in legs.
Okay.
We call it as varicose veins.
Okay.
So now, by people who are exercising without proper undergarment or support, scrotal support, for them, what we have seen is, what we have noticed is varicocele grade can increase.
Okay.
Exercise alone may not get varicocele. If patient is having grade 1 varicocele, if they are doing exercises in an abnormal way, that can increase the grade of varicocele.
Okay.
So now varicocele, there are 3 grades: grade 1, grade 2 and grade 3. Sometimes very severe stage is grade 4. Grade 1, we don't have to do anything. It's very common. It is seen in 30 to 40% of normal people also.
Okay.
So we don't consider grade 1 varicocele as a problem for infertility.
Okay.
It can affect sperm parameters to some extent.
Okay.
But see, generally we say it's around 10 to 20%. It can affect 20 to that
Okay.
extent.
Got it.
But if it is grade 2, it can affect testicular function by 40 to 50%.
Okay.
If it is grade 3, it can affect testicular function by 80%.
Oh, wow.
So now, as grade increases, the damage to the testis also increases, and testicular blood supply slows down, and oxygen levels in testis will go down,
Okay.
and carbon dioxide levels will go up, and toxins which are supposed to be purified, they are not getting purified. They stay in the testis.
Okay.
So this scenario of high carbon dioxide, increased toxins will produce lot of heat in the testes. So all these things can affect testicular health.
Okay.
See, testis has only two functions: testosterone production and sperm production. So initially only sperm morphology gets affected with varicose.
Okay.
It may not affect the sperm production. Sometimes we see patients with 0 sperm count or 1 million sperm count, and when they do a scan, they get grade 1 varicocele, and they get it operated, and then they come to us saying that, sir, I had grade 1 varicocele. Basically, this has nothing to do. It's a myth.
Okay.
So grade 1 varicocele can never damage testis to that extent.
Where it will become 1 million.
1 million. So important thing is to avoid unnecessary varicocele surgeries. So if it is less than 10 millions and grade 1 varicocele, you should not do anything. That is the reason we say now, grade 1 varicocele, don't consider for surgery. If it is grade 2 varicocele or grade 3 varicocele, then only you have to think of surgery. Grade 1 varicocele should not be operated. They are not related to infertility.
Okay.
Directly.
Okay. So, is there any way that a man can identify that maybe he has varicocele, some symptoms that he should watch out for to know that he has to come to an andrologist?
No, it's difficult.
Okay.
See, people, olden days when there was no initial evaluation, they used to come to us with typical grade 4 varicocele.
Grade 4.
Grade 4 varicocele. Basically, we call it as bag of worm appearance. That means now if you take some noodles in a plastic cover, the feel what you get when you feel it, same feel. So if a bag of worms, earthworms are there in a packet and you test it, the same feel, we call it as bag of worm appearance.
Okay.
So all those tortuous veins seen hanging just below the testis, we can recognize it as varicocele. But nowadays we are not seeing those kind of varicoceles. People know that there is some problem and they come to us.
Okay.
And people always say that the moment we say you have varicocele, they say, doctor, I don't have any pain. It's a myth. So varicocele is not associated with any pain.
Okay.
Whether it is grade 1 or grade 4, majority cases it is not associated with any pain.
Okay.
But sometimes if with grade 4 varicocele, grade 3 varicocele, if they are standing for long time, because of the venous stasis, they might feel little discomfort.
Okay.
Because of that hanging sensation. We call it as dragging pain. It's very mild, it's not severe, it's only very mild dragging pain. If there is severe pain and varicocele, there should be something else apart from varicocele which is causing that pain.
Okay.
And second most worrying thing for us is people come to us saying that, doctor, I had pain. I went to a local doctor. This commonly happens because they get pain, they go to local doctor, they do scan, they find grade 1 varicocele, they operate.
But it's not needed at all.
And problem is now pain persists. Now there is a blame game. Now unnecessarily now this patient starts blaming the first doctor. Doctor, I went to a doctor, he did surgery, but my pain increased after the surgery. So now he keeps moving from doctor to doctor. So now because the main problem was not identified. The second doctor thinks already varicocele surgery was done, and most of the times they give them psychiatric medications. They think that this patient is having some psychiatric issues,
God.
and that is why he is complaining of pain. So they put them on antipsychotics. So actually what they have to understand is he was operated for a wrong reason, and his reason is something else. They have to find out the reason and treat it.
Usually, what are the reasons?
Infection.
Usually infection, which is very easily treated.
Very, very easy to treat.
Okay.
So now that is the reason always we give importance to infection. So why I said culture, so culture is very important apart from semen analysis. Why we do semen culture is, now if there is infection, we'll identify. So even before varicocele, why we do semen culture is, if there is an infection, we have enough time to treat the infection along with varicocele. And most of these patients, with grade 1 varicoses, they respond very well with antioxidants.
Okay.
Common antioxidants like coenzyme Q10 and vitamin E, vitamin C, astaxanthin, lycopene, L-carnitine. These are the very common antioxidants. People are worried about taking these medications. Actually, they are micronutrients. See how we take multivitamins. These are the essential micronutrients which are necessary for sperm production inside the testis.
Okay.
For normal person, without any problem, testicular problem, there is enough coenzyme Q10 in the testis.
Right.
So we don't have to give them.
Right.
But when testis is not working properly, we have to replace that coenzyme Q10 with artificial new micronutrients.
Okay.
These micronutrients are very safe. There are no side effects. People are worried. After 1 month, 2 months, they come to us and say, Doctor, I've been taking this medication for 1 month, 2 months. What are the side effects? See, basically, even if they take for lifelong, nothing will happen.
Okay.
Most of the film stars, they take regular antioxidants to
Look better. Better skin health.
Better skin health. And now cardiologists, they prefer 500 milligrams of coenzyme Q10 per day for cardiac health.
Oh, wow. Okay.
Nephrologists, they take 300 mg coenzyme Q10 for kidney health.
Oh.
So now for every organ, coenzyme Q10 is important.
Okay.
So now even if they take coenzyme Q10 for 1 year, there is no problem.
Okay.
But there is one thing which is important, what is happening in most of the treatments is abnormal dosage of these micronutrients. You see, now what happens is, now when a gynecologist or any doctor sitting in OPD, you get to see some medical representatives.
Right.
They come and say, Doctor, my tablet works for sperm motility. Another company person and says, and he comes and says that my tablet is for sperm morphology, but ingredients might be same. So now, if every tablet has coenzyme Q10, here I'll tell one example. So I got a referral from one of the gynecologists saying that, sir, I started treatment for one of my relative. Initially, sperm count improved very well. So second month improved very well. They were very happy. From third month onwards, it started deteriorating. Okay. Now it is almost close to 0. So now I am not able to understand what is happening. He's already on medications. So what happened was there, see now coenzyme Q10, she has put him on 4 different brands.
At the same time?
No, she thought that one is for morphology, one is for motility.
Okay.
So now,
so different ones of the.
So now he was taking almost 1000 milligrams of coenzyme Q10 per day.
Oh God.
So initially the testis was not able to take that load. Initially it responded positively. Then after that, it's like even multivitamins, if you take too much, it's toxic.
Correct.
So overdoses of micronutrients or antioxidants is also toxic. So we have to give them in optimal doses so that it should help testicular function. It should not suppress the testicular function.
Correct.
That is important. So too many antioxidants from different companies at same time, initially they may help first couple of months. Later they have a negative feedback mechanism.
So basically you should take supplements but under the right guidance of an andrologist or a gynecologist who already has the correct knowledge. So with varicocele, grade 1 anyways doesn't require surgery, doesn't affect parameters much. If it does also, supplements is enough. Grade 2 or grade 3, if surgery is required, post the surgery, does their fertility return to normal? Can they get pregnant naturally? Is it something to be concerned about?
Yeah, that is important. See, now we have some specific parameters to assess their improvement. If their testicular size is good, then their prognosis is very good. And second parameter which is very important is FSH level. So FSH level for males is ideally it's around less than 5. 2 to 5 is ideal FSH range. As FSH increases, it says that the testicular function is going down. So by the time we are doing IVF, varicocele surgery, if FSH is more than 10, it's a negative predictor.
Okay.
So there, count may not improve after varicocele surgery.
Okay.
So now FSH is already high. So now in simple calculation, how we calculate is, if FSH is more than 10, that means 80% of the testis is not working. Already either it's not working or damaged.
Okay.
So we may not get back this damaged tissue back to normal. So remaining 20% tissue which is healthy or which is not yet damaged, we can recover that.
Okay.
So now in patients where FSH is more than 10, we have to clearly tell them that sperm count may not improve even after varicocele surgery, but motility can improve,
Okay.
morphology can improve,
Okay.
and if they are having very high DNA fragmentation, it can come down. We can decrease the DNA fragmentation. So realistic expectations should be discussed with the patient.
Right.
So now scenario is, suppose patient is having 5 million count, grade 2 or grade 3 varicocele, already FSH is high. Now there, if this 5 million goes to 10 millions, we can try IUI. So they may not get natural pregnancy, but still we
At
can
least IUI.
downgrade the procedure. So that is how we have to see. If there is severe infection, sometimes infection might be very severe. Patient might be having infections since many years, where in spite of giving multiple antibiotics, they may not respond. Second problem with infections is, you can't put them on too many antibiotics. Antibiotics also can affect sperm production. So too many antibiotics or high dose antibiotics can actually suppress the testicular function and can bring down the production to zero level. You know, high dose antibiotics will work like cancer medications. Now, the moment somebody takes cancer medications, their sperm count becomes zero, because these anti-cancer medications or chemotherapy drugs, they work in the level of cell division. Wherever there is rapid cell division, it stops that cell division. But same cell division is happening in sperm production. So these high dose medications can suppress the sperm production. So we can't give high dose antibiotics.
Right.
So we have to stick on to low dose antibiotic. So when there is severe infection, when there is blockage, so even if you do varicocele, they may not see complete improvement.
Okay.
So all these things have to be discussed with the patient. But varicocele surgery will definitely have a role if it is grade 2 or grade 3. But whether this couple conceives naturally after varicocele surgery, or whether they have to go for IVF, if a couple is having very high DNA fragmentation, failed IVFs, suppose already there are 2-3 failed IVFs. By doing varicocele surgery in that couple, we can only decrease DNA fragmentation. We can make that sperm again usable for IVF procedure instead of going for a donor sperm. So that part is important,
Okay.
which every patient is different. So after doing surgery, what we are expecting in that particular patient, we have to discuss with the couple, and then we have to proceed with surgery.
So, doctor, similarly, how you've explained about varicocele, right? Like that when it comes to DFI. So, if somebody has gotten their DNA fragmentation index checked, the normal range is below 20%, right?
15.
Below 15% is considered
Yes.
good. So, if somebody's is higher, say 25%, 35%,
Yes.
how long does it take for it to come to the normal range?
Yes. So DFI less than 15 is ideal range.
Okay.
15 to 25 is borderline range. Even to less than 25, still they can have natural pregnancy. But
Okay.
it's a borderline range.
Okay.
But more than 25, it's abnormal. More than 40, it's very poor. So very few couples, they can conceive with more than 40 DFI. So now here what we have to look for is treatable causes for DNA fragmentation. Basically, if you look for causes for poor DNA, high DNA fragmentation, one is genetic cause, second one is infection, and third one is varicocele, and fourth one is heat, increased testicular temperature.
Okay.
So now this increased testicular temperature, see if a person is very obese.
Hmm.
There is too much of thigh fat. Whenever he is walking, because of the friction, there is too much of heat. It is very difficult for us to bring down that temperature. So if it is an external heat, if they are using laptops or they are working in very hot environments, we can avoid that heat.
Correct.
But if their body physics itself is causing too much of heat, then just by cooling it for a couple of minutes, we can always ask them to use ice packs. But 24 out of 24 hours, if they are cooling the testis for 5 to 10 minutes, it may not help. So that is one reason. Second one is varicocele. By doing varicocele, we can bring down their DNA fragmentation. Infection is not related to testis.
Okay.
See, normally this high DNA fragmentation, we divide them into 3 causes: pre-testicular cause, post-testicular cause, and post-testicular cause. So post-testicular cause means there might be normal sperm production. With normal DNA, sperm is coming out, it is entering the transport system, and once it is coming to storage level in the seminal vesicle, because of the infection, it can get damaged.
Okay.
So there we have a fair chance. We can just take a sperm from testis, where the sperm is not exposed to any toxins or infection. We can use it for IVF. But if there is infection, and unless you treat the infection, DNA fragmentation may not improve. So you have to properly evaluate for the high DNA fragmentation, the root cause for high DNA fragmentation, and you have to treat it.
Okay.
And it takes at least 2 to 3 months.
Okay.
That is the reason. And DNA fragmentation is an expensive test. It costs around 7,000 to 8,000 rupees for the patient. So now, instead of repeating this test every month, it's better to repeat once in 2 months or once in 3 months.
Okay. So one thing you mentioned is that when somebody is of overweight, high
Yes.
weight, it can lead to more heat,
Yes.
which can cause more issues.
Yes.
So how much do things like weight, lifestyle, smoking, alcohol, the kind of food they're eating, stress levels, apart from infections, apart from varicocele, how much does lifestyle affect sperm parameters?
Yeah, I think I forgot to mention this. See, smoking is also one of the major risk factor for high DNA fragmentation.
Okay.
People think that they can smoke 1 cigarette per day. It's not a severe kind of addiction. See, now people with 10 cigarettes, smoking 10 cigarettes, they can have normal DNA fragmentation in initial days. Later days, they can have high DNA fragmentation. So now, if a person is smoking 10 cigarettes per day, when he was married, how fertile is his female partner? That is important. Sometimes female partner is highly fertile. So in spite of some sperms having abnormal DNA fragmentation, still she can conceive. But this can't happen to all the other couples.
Correct.
If there is female factor, even oocyte quality is low, then both sides, if there is problem, then chance of natural pregnancy or natural conception or even IVF success rate goes down with when both sides there is a problem. So now we have to give importance to lifestyle. So in lifestyle, 3 things. One is smoking. Smoking can affect sperm concentration, motility, morphology. It can suppress testosterone producing cells.
Okay.
Not the testosterone producing cells, so that there can be permanent damage.
You can't even reverse.
Yes, we can't reverse it. And any form of tobacco. So direct tobacco like gutkhas, chewing tobacco is more dangerous. And smoking and tobacco. So more than smoking, direct chewing tobacco is 10 times more dangerous. And when it comes to alcohol, people think that occasional alcohol intake is good, but it's not. At least in the fertile window, at least for the 2 to 3 months when they're trying for fertility, it's better to avoid alcohol.
Okay.
Even alcohol can impact sperm motility, morphology, and hormonal production. And sleep is very important. In males, not only in males, in females, hormonal production is very good at night. If there is very good nighttime sleep, which is around 7 to 8 hours, then there is very good hormone production. You are allowing your body to produce enough hormones, and you are allowing your body to regenerate cells.
Right.
So now sleep should be at least for 7 to 8 hours, that too particularly during night time. That is where hormone production happens. And exercise, there are so many myths about exercise. People think that only weight training will increase the testosterone production. So even simple brisk walk is enough to increase the testosterone production.
Okay.
This is very important because the moment we ask them to exercise, they join gym and then they take whey proteins, come back with abnormal hormones. So now there is no need to take any artificial proteins. Normal proteins like eggs, chicken, they are enough to maintain their protein intake. And exercise, brisk walk for 30 to 40 minutes in a day, that is more than enough, unless they want to build their muscle.
Okay.
See, for weight loss, it is different. If somebody wants weight loss, then if you diet, then first thing you will lose is your muscle.
Correct. So then
Fat.
you should consume more
Proteins. So you have to increase your protein intake.
Right.
And you have to build your muscle.
Correct.
Along with cardio exercises, you have to do strength training. Because if your muscle is powerful, it consumes most of your energy.
Right.
Then your metabolic rate increases.
Correct.
Then your body starts consuming the fat.
Yeah.
Otherwise, it will only affect the muscle. So muscular atrophy is common.
Yeah.
So now you should not lose the muscle. You have to lose the fat. So for weight loss, you have to do both cardio and strength training. But just for testosterone or fertility's sake, simple cardio exercise is enough. Swimming, jogging, brisk walk. These three are more than enough, apart from regular day-to-day activities.
Okay. So when it comes to whey protein, another common question is, if you're not getting your protein requirement through your normal food sources because you're not able to consume that much protein, especially for vegetarians, is whey protein recommended then to meet just your protein requirement, not more than that?
No, see, here for building your muscle, definitely whey protein helps.
Okay.
So what happens, your muscle needs testosterone and this whey protein carries your testosterone to the muscle. So now even this transportation of testosterone in the body depends on proteins. It gets attached to proteins and gets transported. Now if your idea is to build muscle, then whey protein is good. But if your idea of exercise is to build up your testosterone or for fertility treatment, then whey protein should not be taken. What happens is, already when testosterone is low, you are allowing this low testosterone to get carried into the muscle and you are helping the muscle building.
Okay. Instead of it being where it needs to be.
Yes. Okay. So now already there is deficiency.
Now you're moving it away.
Yes.
Okay.
So that is why we don't recommend whey protein when your testosterone levels are low. Okay. So ideal way, what has to be followed in weight training is, first you have to build your testosterone. You have to take your testosterone to supranormal levels. Then start whey protein. So then your testosterone is consumed properly.
Correct.
But when your testosterone is low, without improving testosterone, if you are taking whey protein, it causes more damage.
Okay. So you have to take it at the right time.
Yes. Last month I had a cardiologist.
Okay.
So he came to me and said, Dr. Rahul, last 1 month I'm noticing erectile dysfunction. Then he said, Doctor, I'm a cardiologist. I regularly exercise. My fitness levels are very good. My diet is well controlled. I'm only 38. Why I got this erectile dysfunction? So he himself got all these basic testosterone levels, everything, total testosterone was done. So then I asked him, did you change anything in last couple of months? He said, my physical trainer asked me to start whey protein.
Okay.
So now whey protein, his testosterone level, total testosterone was good. But his free testosterone very less. It was not evaluated. So now, once he started this whey protein, the free testosterone level has significantly gone down.
Okay.
So that is what important for their sexual function.
Okay.
So now that was the only reason for this. So that is the reason. See, all those hair loss medications, like finasteride, dutasteride, they will block testosterone receptors.
Okay.
And once you take them, they can block your receptors for 6 months to 2 years. So that is the reason we say, don't see, whenever you are taking hair loss medications, don't depend on these drugs like finasteride or dutasteride because they can cause erectile dysfunction. And they have to, their agony for 2 years, because once they lose their sexual function, till they get it back, they'll be behind us. So 2 years they have to continue their treatment. So hair loss medications, better to avoid these finasteride kind of medications. And whey protein, once you complete your family, your idea is to build your muscle, take whey protein.
Or if you've gotten the testosterone tested and you have enough
testosterone,
free
then
testosterone, then
yes,
you can take
yes.
it. Okay. So also when we see a lot of couples, right, a lot of importance is given to the woman's weight,
Yes.
to what she's eating,
Yes.
to how much she's exercising. But men are overweight. They don't want to
Yes.
do any exercise. They don't
Yes.
want to change their meals from white rice. They want
Yes.
to continue eating what they're eating. Don't
Yes.
want to move to complex carbs. Don't want to, match their
Yes.
protein intake. So how important is it? Or is it not important at all for male fertility?
See, one of the major factor for sperm count improvement is change in lifestyle. See, overweight, it affects fertility in many ways. One, overweight, obesity, inflammatory cells, they affect testicular function. Then second one, obesity causes more heat in testes because of their increased scrotal temperature. Then it affects hormone production, it affects sperm production. And once testosterone levels goes down, then they start noticing sexual dysfunction. And it's a slow process. They don't actually think that there is sexual dysfunction. See, initially the libido level will go down because of low testosterone. They don't think that the natural drive is going down. They think, doctor, I'm married for almost 3 years. Slowly my libido is going down. We are probably we are getting bored. So all those reasons for because they don't recognize that their drive has gone down significantly. So initial sexual frequency after marriage will be around twice a day or 5 to 6 times a week. So after 1 year, slowly it goes down. But these people who are obese, their sexual frequency are once or twice in a month. They don't think that it's a problem, and most of the times they think that they are busy at work. And they are busy at work and they don't get time in the weekends. They have so many things to do in the weekends apart from exercise. So now the common reason they say is, doctor, I don't get time for my exercise. Busy at work. My work don't allow me to do exercise. But these are all silly reasons. If you want to do exercise, it's simple. You can take a break for 10 minutes during your work. You can walk. During your lunch time, you can walk for half an hour, come back and work. So now there are standing desks. So you can, instead of sitting continuously, you can stand and work at your workplace. So now foot count, basically we call it as step count, is important. See, even though you don't have time to do regular workout, if you can walk for at least 6,000 steps per day, that is more than enough. But if it is brisk walk, it is much better. And they have to cut down their carbs. See, now, unless there is proper motivation, they don't do it.
Correct.
So only two things can help. A doctor's advice is always ignored. They only listen to that. The moment they get out of my clinic or OPD, they forget about that. So now that is the reason now we say community walking or couple walking. So community walking, if you have friends, then
become a fun activity.
It's a fun activity. You don't actually count your steps. You keep walking, talking, So by the time you know that you realize you would have completed 6,000 to 10,000 steps. Or couple walking. We always, if one is not interested, other has to force them.
Yeah.
If they go for a walk, they can talk. That will increase their bonding. Exercise is done. And see, now if somebody has to walk alone, including me, it's very difficult.
Yeah.
To get that motivation, it's very difficult. If somebody is there with us, then at least one of us will feel guilty.
And push the other. Yeah.
Yes. So now always do exercise with your partner or some friend. Then it works.
And I think a large part of weight loss is food,
Yes.
is nutrition, right?
Yes.
Because if you're doing all the exercise but you're eating
Yes.
unhealthily,
Yes.
you're never going to lose that
Yes.
weight. So getting the right diet also is just as important.
That's actually very easy. Now, I think since you have a good dietitian, you have to tell us. But see, problem is people think that they can't. See, in India, majority are rice eaters, particularly in South India.
Correct.
Now, whatever you eat, it is indirectly or directly associated to rice.
Correct.
Most of the breakfasts are again related to rice.
Idli, dosa with
Idli,
rice.
dosa.
Yeah.
Now, including me, see my old pictures, I was almost 90s. So always, because I was busy with my patients, I used to think that I have to see all my patients, waiting periods. Then see, I used to think that cutting rice is a difficult part. But now I don't take any rice. So now, but I don't feel that craving also. See, first couple of days, see, people once they start noticing that, or once
The
they
change.
experience,
Yeah.
then it's very easy.
Yeah.
See, if you take high protein diet, that will kill your hunger.
Yeah.
You
correct.
don't feel like eating.
Correct.
You lose that craving part. So now, if they need if only thing what they need is proper counseling, proper support, some dietitian has to be behind them, and once they practice it for a week, and once they see that change,
Correct.
then they will never go back to rice.
Right. They say in the beginning it's discipline, after that it's the results that
Yes,
keep you
results.
motivated.
Yes.
Yeah. So one more question that I have here is, so if somebody is overweight, of course lifestyle is making a huge difference because you have to eat correctly, you have to exercise in order to lose that weight.
Yes.
But if somebody is not overweight, they're
Yes.
in the correct BMI,
Yes.
even then is lifestyle important for male fertility?
There, see, basically weight management is not an issue, but for fertility, if their hormones are normal, basically, even though that means whatever they are doing
Is right.
it's
Yeah.
enough. It's
Yeah.
right.
But
So
if,
with exercise is always better. It can boost hormone production, but if hormone levels are already normal, then we don't have to worry about it.
correct. And if you're already experiencing some sort of infertility, that means something is going
So,
wrong. So you should change your.
Yes, some other reason is there.
Yeah, correct. Okay. So another thing that you had mentioned, doctor, is sexual dysfunction. So a
Yes.
lot of men are, having sexual dysfunction, maybe erectile dysfunction.
Yes.
So because of that, we've also noticed that they're going towards fertility treatments.
Yes.
So is this actually needed if somebody is having some sort of sexual dysfunction? Can it be cured? Can they still conceive naturally?
No, what you said is exactly correct. See, 50% of males who are actually having sexual problems, they are actually pushing their partners for fertility treatments.
Okay.
There are so many myths about this sexual dysfunction. So they think that sexual dysfunction medications are not good for body. They have side effects. They have addiction, and they think they can cause severe cardiac side effects. So now,
Correct.
because of all these myths, people think that why should I take all these medications?
Yeah.
So either they depend on some herbal medications or homeopathy medications. They try for a couple of months. If they don't work, they'll leave that, and they start pushing their partners for fertility treatment. We see at least 2-3 couples per day where the reason for IVF, IUI was only their sexual dysfunction.
Voluntarily, they have gone
Yes.
for IVF or IUI.
We had a patient from Australia.
Okay.
So he had 7 IVF failures.
Oh my God.
7 IVF failures. Then they came to India for 8th IVF. So now gynecologist called me and said, sir, this for this couple, this is 8th IVF, but we don't have time to evaluate. So they came here only for 1 month. So now I don't have time to do DFI. So I'm directly, because DFI sometimes it takes around 1 week for the report to come.
Okay.
So I directly started the treatment. So now instead of taking regular sperm, why can't we take a testicular sperm? So now I said, okay, I'll come there. So we took testicular sperm and we did IVF. It was not successful.
It failed again.
Yeah, eighth IVF. So then they cancelled their trip after that failure. Then they came to me. And I met him first time in my operation theatre. And just before my procedure, I asked him, what is wrong? He said, sir, I asked him, why you are doing all these IVFs? Is there any sperm problem? Then he said, sir, there is some problem in having intercourse. So that is the reason we couldn't get any doctor there. We went to a doctor, he has given Viagra. So I'm scared of taking Viagra. So I stopped taking. Then after that, he came to me and said, doctor, is there any other way? Now my wife is done.
Fed up with the
She is not ready for anything. Then I asked him, what is the problem? So they never had intercourse in their 8 years of marriage life.
Oh no.
So all this, she underwent 8 IVFs with all this hormonal treatment. Only because of this, I told him, you are actually lucky to have this kind of wife.
So
in some
supportive
communities,
still.
if couple is not having intercourse for first 3 days, they start making an issue. They come to clinic, both
Correct.
parties, they come to a clinic, they start fighting.
Correct.
Even before we evaluate, they start fighting in the corridors.
Yeah.
So now we see now you are lucky to have this kind of wife. So now what stopped you from taking this medication? So he said, sir, I'm having fear of taking those medications. I'm the only son. What if I die with after taking Viagra? So it sends a wrong signal saying that somebody died with after taking Viagra.
More embarrassment.
More
also.
embarrassment. And then I said, who asked you to take Viagra? So there are very simple treatments which has almost zero side effects for sexual dysfunction.
Okay.
This is a common myth in most of the males.
Okay.
So it's a very simple. And this couple, we had just put them on medications for 3 months. We sent them back. 6 months, they had natural pregnancy.
Oh wow. After 8 IVF.
First call came from my gynecologist because I don't give my phone number. My fertility specialist called me and said, sir, what you did, sir, after 8 IVFs, they got natural pregnancy. They called me. So, see, his sperm was totally normal. Why IVF failed, nobody knows. But I think it was there in the...
Written for them like that. Yeah.
They got natural pregnancy. And he must have sent at least 30-40 patients from Australia.
To you after that.
All his friends, he informed everybody that he took treatment from me. He said, sir, this message has to go to everyone. So now he said openly to all his friends saying that, see, this was my problem. I went to a doctor, I got it done. If you have any problem, go and meet doctor. So I got so many patients who had sexual dysfunction because see, most of these males, they don't open up. First thing is they want assurance. So only when they know that these treatments are very safe, then only they come forward.
Correct.
So now this knowledge or this particular topic, still there are so many taboos.
Yeah.
So once these males starts taking these medications, then they will get confident.
Correct. So when there's ED, it's almost like every time, they're not able
Yes.
to. But sometimes there's performance pressure, especially
Yes.
during conception timing. Because there's so much pressure, it becomes mechanical.
Yes.
Even this we're noticing a lot
Yes.
where as soon as they start planning, then they start having issues.
Yes.
So that is also something that's happening a
No,
lot.
it's a very common scenario. People who has erectile dysfunction, they don't try on other days. Their only idea is to get pregnancy. So what they do is they try to have intercourse only on those fertile days. So that particular day, it increases their anxiety. Even normally, see, having intercourse with regular drive is different.
Correct.
But if some gynecologist says you have to have intercourse on that particular day, it may not happen.
Correct.
So now these people, the biggest mistake or commonest mistake what they do is, in spite of having a problem, they try to have intercourse only on the fertile days. So because of this performance anxiety, it won't happen. So that is one of the reason for infertility. So now they should not do that. Actually, that will increase their anxiety. Regular intercourse actually brings down their anxiety, performance anxiety. So now they don't get confidence unless they have intercourse. So now that is where all these newer drugs like tadalafil have come into picture. Now tadalafil is like, what I can say is it's a game changer in ED treatment.
Okay.
Now anybody can take this tadalafil tablet
Okay.
without major side effects, without major cardiac side effects. So now you might have seen so many videos on tadalafil on YouTube and social media. Sometimes we say, if you have problem, you don't have to come to an andrologist. But these medications are not available over the counter. They need some doctor's prescription. Without any fear, they can go to local doctor, any MBBS doctor sitting in any village, they can give a prescription for tadalafil. So what we do is we give this tadalafil on daily doses. So if you give this tadalafil for 1 month or 2 months, their performance anxiety will go down and their confidence levels will go up. And after a couple of months, what we do, we will try to decrease the dosage.
Got it.
That confidence levels will continue. They think that they're totally normal. And that fear factor will totally go away.
So a lot of it is stress related also.
Stress related.
So it's important to bring your overall stress down. So.
After this tadalafil, see, tadalafil is almost now, it's around 7 to 8 years. It has totally changed ED treatment.
Okay. So one last question that I have, Dr. Rahul, is earlier you had mentioned Ayurveda treatments.
Yes.
So a lot of times before coming to a doctor, they just go to a
Yes.
local Ayurveda doctor, take homeopathy or take some herbs and try to treat themselves. So what is your opinion on this? How safe is it? Is it okay?
Yeah. See, now there are so many Indian herbs which help in fertility and sexual dysfunction. So now probably our ancient doctors, they were all actually giving all those herbs. Shilajit, Ashwagandha, they are very good. Only problem was how they used to make it. So olden days, they used to directly prepare them. So later, they started storing them and preparing them. So in some centers where they used to manufacture, they used to mix lead as one of the ingredient. Lead. That is where lead, knowingly or unknowingly, they used to mix lead. And lead toxicity was very high with those medications. But now things have changed. Most of the pharma companies, they started producing these herbs. So now they are very safe. As long, see, now they are like any other medications. But only thing what we have to understand is how much dosage. So if you ask me, any other tablet, see now paracetamol, we know how much dosage we have to take.
Correct. Regulated.
Regulated. So 650 milligrams, it's enough. So, but for these medications, there is no dose-based studies. We don't know how much we have to give. And second thing is, now there are not many qualified super specialists in Ayurveda and this one.
Correct.
Homeopathy. See, actually there are good medications, but you have to understand how much dosage you have to give, how much dosage, how many days you have to give, and when to stop it, and when to change it. So since there are not many specialists, so basic Ayurvedic doctors, homeopathy doctors, they have started giving these things without knowing when to stop. That is where problems have started. And sometimes patients they themselves Google and they start taking medications. That is the second issue.
Yeah.
And see, now when a patient comes to a doctor with low testosterone, if I give them one drug for boosting their testosterone, so now too high testosterone is also not good for fertility. Too low testosterone is also not good for fertility. Most common problem what we see is we give for 1 month, testosterone improves little bit, then we continue. Next month they come back with a report where testosterone levels are totally abnormal.
Too high.
Too high. When we ask them why this is too high, they say, doctor, my friend has given this medication, another doctor. So they keep taking all these Ayurvedic herbs which boost their testosterone to supranormal levels. Very high testosterone will again suppress sperm production. So they have to take it with caution. And these medications, as a drug, there are no side effects. But dosage related side effects can be there.
And because there's no known or certified dosage, that becomes the problem. Okay. First of all, thank you so much, Dr. Rahul, for all of your time. Any final words to couples who are trying to conceive, want to conceive naturally, whatever they can do to avoid any treatments? Any final words of suggestion from a male fertility factor?
See, now the main issue here is anxiety. When a couple knows that there is some problem, whether it's a female side or male side, they are, because of that anxiety, they are not waiting for proper doctor consultation. They are jumping and directly going to fertility center. And they are ending up with IVF without any evaluation. So now when there is an issue, you better go to a gynecologist, not a fertility specialist. First go to a gynecologist. If there is male factor, go to an andrologist or urologist, get it evaluated. So majority times, as I said, in 80% of cases, they might be having a very small problem which can be treated easily. So don't jump into conclusions and go for IVF. Then they should not come back for normal treatments. So anxiety is understandable. The moment they know that there is no sperm count or low sperm count, there can be anxiety. But wait patiently. Most of these issues can be correctable. So go for treatment, wait for a couple of months, then think of going for IVF treatment.
If naturally it doesn't get fixed, which it might also.
Yes. And if you don't have enough time, or if there is no guidance, so there are people who are ready to give guidance. Now there are online courses, online programs which help in fertility guidance and which help in diet management, which help in exercise, what kind of exercise you have to do, how you have to do. Then follow all these things. Then in spite of that, if there is no natural pregnancy, then you have to think of IUI first. Don't go for IVF directly. Do couple of cycles of IUI, then go for IVF. And second mistake what they do, you see, the success rate of IUI is not 100%. Even IVF is not 100%. They have to understand. And when they go to an IVF or a gynecologist for an IUI procedure, when IUI natural pregnancy is not possible, we ask them to go for IUI. When they go for an IUI, they should not go there with abnormal expectations.
Yeah.
And the moment they start asking too many questions to the gynecologist or fertility specialist, they think why they should do IUI. When patient is having abnormal expectations, they always counsel them for IVF. So your anxiety will change the treatment. If you go to a gynecologist and say, Madam, I understand the success rate of IUI. You try your level best. We accept the failure. Then they will try to do IUI. If they go to an IVF specialist and ask for success rate of IUI, then immediately they will get counsel for IVF and they will go for IVF.
Correct. And I think another thing is, even if you're getting fertility treatments, it's still important to manage your weight, still
Yes.
important to manage your BMI,
Yes.
eat correctly, because you'll improve the success of those treatments also. So not rushing in even if you decide to go for a treatment.
Yes, see, 50% is lifestyle modification, 50% is medications.
Yeah.
So, lifestyle modifications, all these are important. Regular exercise, weight loss, habits, we have to stop smoking.
Yeah.
So, one point what we forget to change. See, if a person is smoking, even if he stops immediately, the effect of this nicotine or smoke, tobacco, stays inside testes for 3 months.
Oh, wow. Okay.
So now you will start seeing improvement after 3 months of stopping your smoking. So sometimes what they do, they stop smoking, they take medications, and if they don't see improvement, they start smoking again. They say, doctor, I tried all those things, nothing is happening. They have to stop it for minimum 3 months. That is important.
So, Dr. Rahul, is this program particularly for couples who are only trying for natural pregnancy, or even for people who want to go for a fertility treatment?
No, for everyone. See, basically here, our first goal is to get natural pregnancy. Second goal is to improve their fertility levels. Suppose a male is having severe genetic problem, his sperm quality is not good. They are planning for a fertility program or a fertility treatment like IVF or IUI. We can guide them properly. We can tell them what is important. Why DNA fragmentation important? See, whatever we spoke today, what is the importance of culture? What is the importance of hormones? Importance of vitamins? So what we do is we try to improve their sperm health. So sperm health and egg health. So once we improve, it automatically improves success rate of their fertility treatment.
Right.
So not only for natural pregnancy, it also helps. See, there are so many couples who had multiple IVF failures. Then they joined this program. First time they came to know about DNA fragmentation index, semen cultures. Then we help them decreasing their DNA fragmentation levels. And along with, see, basically, to give an example, there are so many Indians who are actually staying in other countries. If you take US or UK or Europe, getting an andrologist consultation or fertility specialist consultation is a big task.
Correct.
You have to wait for a month to get their consultation. If you need any test like semen analysis, semen culture, DNA fragmentation, unless your doctor prescribes, they don't do it. And even if you get a prescription, it takes months for you to get an appointment for this.
Correct.
But if you are well prepared, and if you go to your doctor and say, doctor, I need this test, my Indian doctor suggested this test, then they can do it immediately. So that is how it is helping all those people who are actually staying abroad. And people who are actually staying in peripheries and where their semen analysis report, they're just trusting their basic semen analysis reports and getting carried away. We are trying to help them, we are helping them in assessing their semen parameters, where things are going wrong, and we are getting them tested properly, and that is how we are boosting their fertility levels.
So if somebody just wants to, say, are living in a city environment, but they just want to have a very smooth, natural pregnancy, is this something that's recommended for them even then?
No, see, for people who are actually staying in the city, now see, if a doctor is staying in the other part of city, going to doctor every time is a big task. Now, getting doctor's appointment, you have to travel for 1 to 2 hours in the traffic, wait for doctor's appointment, which is 10 minutes, then coming back is a big task. So this program will avoid all those things.
Yeah.
And second thing, as I said, you may have too many doubts about fertility.
Correct. So even if you visit the doctor, you might not get enough time.
So
they can continue with the program.
Enough time to clear all these doubts. This program will help you in clearing all those doubts. And see, when I have a session for 30 minutes to 1 hour, so several people ask me different questions.
Correct.
It's like a lecture.
Yeah.
So you know about your problem and other problems. So now what way this particular test is helping their fertility treatment, all those things you can understand.
Thank you so much for all of your wisdom, Dr. Rahul, and sharing, everything from your experiences. I'm sure this is going to help a lot of couples and a lot of people take the right decision in their fertility journey.
Thank you.
Thank you. Thank you so much.